I'm about to show you something that could explain why your blood pressure won't come down, even though you're taking your medications exactly as prescribed. New research published just weeks ago has uncovered 5 critical mistakes people make when taking vitamin D. Mistake number 1, the most dangerous and most common, can add 15 to 20 points to your blood pressure reading. I'm Dr. Moore. After 2 decades as a cardiologist, I've seen countless patients stuck on 3 or 4 blood pressure medications who were unknowingly making these exact mistakes with their vitamin D supplements. The pharmaceutical industry isn't talking about this. There's no profit in teaching you how to use a simple, inexpensive supplement properly so you might actually need fewer drugs. But the research is overwhelming. A study in the Journal of the American Heart Association followed over 15,000 people for 8 years and found that correctly used vitamin D can lower blood pressure by 10 to 14 points. That's like adding another blood pressure medication, except it costs pennies a day and has virtually no side effects. By the end of this video, you'll know exactly what these 5 mistakes are. You'll understand why mistake number 1 is so catastrophic that it can completely block the cardiovascular benefits vitamin D should provide. And you'll walk away with a complete step-by-step protocol to start taking vitamin D the right way, starting today. Let's begin with mistake number 5, because this one is going to surprise you. Most people have never even heard of it. Mistake number 5 is taking vitamin D without vitamin K2. And this isn't just about making vitamin D less effective. This mistake can actually make things worse by driving calcium into your arteries. Let me tell you about Thomas, age 71. His doctor discovered he was vitamin D deficient. His level was 18 and prescribed vitamin D supplements. Thomas took them faithfully for 5 years. His vitamin D level came up to 35, which his doctor considered acceptable. But his blood pressure didn't improve. In fact, it got a little worse. It started at 148/88 and crept up to 156/92. His doctor was stumped. Then Thomas developed chest pain. A cardiac workup showed significant arterial calcification. His arteries were becoming stiff and rigid. His doctor was puzzled. Your cholesterol is fine. You don't have diabetes. Why is your arterial calcification so advanced? Then a cardiologist who had just attended a conference on vitamin D asked a simple question. Are you taking vitamin K2 with your vitamin D? Thomas had never heard of vitamin K2. Here's what was happening. Vitamin D increases calcium absorption from your diet. That's great for your bones, but that extra calcium has to be directed to the right places. Without vitamin K2, that calcium can deposit in soft tissues, including your arterial walls. K2 activates specific proteins that shuttle calcium into your bones, where it strengthens them and keeps it out of your arteries, where it causes damage. Thomas had been taking high doses of vitamin D for 5 years with no K2. All that extra calcium was gradually depositing in his arteries, making them stiffer and driving his blood pressure higher. The supplement that should have been helping was actually accelerating arterial damage. The fix is straightforward. Always take vitamin D3 with vitamin K2, specifically the MK7 form of K2. You need 100 to 200 micrograms daily. Some supplements now combine D3 and K2 in one capsule, which is ideal. If you take them separately, take them together at the same time. This combination not only prevents arterial calcification, it can actually help reverse existing calcification over time. Studies show that people who take D3 with K2 have more flexible arteries, lower blood pressure, and better cardiovascular outcomes than people who take D3 alone. This is not optional. If you're taking vitamin D without K2, you need to add K2 immediately. Now let's move to mistake number 4. This one explains why so many people's vitamin D levels stay low despite taking supplements for months or years. Mistake number 4 is taking vitamin D without adequate fat for absorption. Consider Patricia, age 69. She'd been taking vitamin D for 3 years. Her doctor prescribed 2,000 IU daily. Patricia took it every morning with breakfast, a slice of toast, and black coffee. After a year, her vitamin D level had barely changed, starting at 22 and only rising to 28, still deficient. Her doctor doubled the dose to 4,000 IU. A year later, her level was 31. Better, but still not where it needed to be. Patricia was frustrated. I never miss a dose. Why isn't this working? The issue was absorption. Vitamin D is fat soluble. It must be taken with dietary fat to be absorbed properly. Patricia's toast and coffee breakfast had almost no fat. Most of the vitamin D she swallowed simply passed through her system unabsorbed, but it's not just about having any fat present. The type of fat makes a huge difference. New research shows that vitamin D works best when taken with omega-3 rich fats. Omega-3s not only enhance vitamin D absorption, they also reduce inflammation that can block vitamin D receptors. We changed Patricia's routine. Take vitamin D with 1 teaspoon of fish oil or cod liver oil every morning. The fish oil provided both the fat needed for absorption and the omega-3s that work synergistically with vitamin D. Within 3 months, her vitamin D level jumped to 58. Her blood pressure, which had been stuck at 152 over 90, fell to 136 over 82. If you can't tolerate fish oil, good alternatives include taking your vitamin D with a handful of walnuts or a tablespoon of flaxseed oil. The key is that you need those omega-3 fats. Taking vitamin D with random fats, especially omega-6 heavy vegetable oils, does not work as well. Omega-3 fats specifically are what supercharge vitamin D absorption and function. This is critical. If you're swallowing vitamin D dry with a glass of water, you're wasting most of it. If you're taking it with a low-fat meal, the same problem applies. 1 tablespoon of fish oil or a handful of walnuts with your vitamin D every day. This simple change alone can double your absorption. Now we come to mistake number 3. This one is especially shocking because it involves the very form of vitamin D most doctors prescribe. Mistake number 3 is taking vitamin D2 instead of D3. Let's look at Robert, age 68. His doctor found his vitamin D level was 16 and prescribed prescription vitamin D, 50,000 IU once a week. Robert took it faithfully for 6 months. His level rose to 32, technically in the normal range, but his blood pressure didn't budge. It stayed at 158 over 94. His doctor was confused. Your vitamin D is normal now. That should have helped. Here's what neither Robert nor his doctor realized. Prescription vitamin D is almost always vitamin D2 or 𝐒𝐫𝐞𝐻. It's synthetic. The pharmaceutical industry prefers D2 because it's patentable and profitable, but D2 is far less effective than D3. Vitamin D3, or 𝐏𝐫𝐞𝐬, is the natural form your skin makes from sunlight. The new research shows D3 is about 5 times more effective than D2 at raising blood levels. It stays in your system longer, binds more strongly to vitamin D receptors, and, most importantly for blood pressure, provides far better cardiovascular protection. People taking D2 showed minimal blood pressure reduction even when their blood levels appeared normal. People taking D3 experienced significant drops in blood pressure. We switched Robert from prescription D2 to over-the-counter D3, 5,000 IU daily. Within 2 months, his level rose to 62. Within 3 months, his blood pressure began to fall, first to 146 over 88, then to 138 over 84. After 6 months on D3, his average blood pressure was 132 over 78, and his doctor was able to reduce one of his medications. Check your bottle. If it says ergocalciferol, that's D2. If it says cholecalciferol, that's D3. You want D3. It's available over the counter at any pharmacy or health food store. Don't let anyone tell you D2 and D3 are equivalent. The research is clear, they're not. D3 is dramatically superior for cardiovascular health. If your doctor prescribed D2, show them this research and ask to switch to D3. Most doctors simply aren't up to date on these differences. They're working from what they learned in medical school years ago. You now have current information. Use it. Let's move on to mistake number 2. This is where most people realize they've been undercutting their own results without knowing it. Mistake number 2 is taking too low a dose to reach optimal blood levels for cardiovascular protection. Meet Margaret, age 73. Her doctor discovered a vitamin D level of 20 and prescribed 1,000 IU daily. Pretty standard. Margaret took it diligently for a year. Her level rose to 34. Her doctor was pleased. Your vitamin D is fixed. Good job. But Margaret's blood pressure didn't move. It remained at 154 over 92. She was disappointed. She'd heard vitamin D should help blood pressure. Why wasn't it helping her? Here's the core problem. The doses most doctors recommend, 1,000 to 2,000 IU daily or 50,000 IU weekly, are based on preventing bone diseases like rickets and osteoporosis. Those guidelines are about bone health, not cardiovascular protection. The research shows that meaningful blood pressure reductions occur when vitamin D levels are in the 50 to 70 nanograms per milliliter range, not the 30 to 50 range considered merely adequate for bones. To reach and maintain a level of 50 to 70, most people need 4,000 to 6,000 IU of D3 daily, sometimes more, depending on body weight and individual absorption. Margaret's level of 34 was fine for bone health, but too low for cardiovascular benefits. We increased her dose to 5,000 IU daily of D3, taken with fish oil and K2. Within 3 months, her level hit 58. Her blood pressure began to drop, down to 144 over 86, then 138 over 82. After 6 months, she was averaging 132 over 78. The research is consistent. When people raise their vitamin D from deficient, below 30, to optimal, 50 to 70, their systolic blood pressure drops by an average of 8 to 12 points. But this only happens when levels are truly in that 50 to 70 range. If your level is stuck at 32 or 35, you won't see those cardiovascular benefits. Most people need 4,000 to 6,000 IU daily to get there. Some need more. The only way to know is to test. Check your level after 3 months of supplementation. If you're not between 50 and 70, adjust your dose. Work with your doctor, get tested regularly, and find the dose that keeps you solidly in that optimal range. And now we come to mistake number 1, the most common, the most dangerous, and the most devastating error in vitamin D supplementation. This single mistake can completely erase the blood pressure benefits vitamin D should be delivering. It's the reason so many people take vitamin D for years and see no cardiovascular improvement. Here it is. Mistake number 1 is taking vitamin D in the morning instead of at night. Let's look at Harold, age 74. His doctor prescribed vitamin D for a deficiency. Harold took it every morning with breakfast, just as the bottle instructed. He took D3, he took it with food, he added K2, he increased his dose to 5,000 IU. His vitamin D level rose to 56. Perfect. But his blood pressure didn't budge. It stayed at 162/96 despite 3 medications. His doctor was at a loss. Then Harold enrolled in the research study I've been referencing. He was randomly assigned to the group that would take vitamin D at night instead of in the morning. Same dose, same form, same K2, same fish oil, only the timing changed, night instead of morning. Within 8 weeks of switching, Harold's blood pressure began to fall, 152/90, then 146/86. After 3 months, he was averaging 138/82. His doctor cut back 1 blood pressure medication. After 6 months of nighttime vitamin D, his blood pressure averaged 128/76, and 2 of his 3 medications were reduced. Why does timing matter so much? Vitamin D is deeply involved in regulating your circadian rhythm, your 24-hour internal clock. When you take vitamin D in the morning, it reinforces the signal that it's daytime, time to be active, alert, and on high output. That pushes your sympathetic nervous system, the fight or flight system, into gear. Stress hormones rise, heart rate increases, blood vessels constrict, and blood pressure goes up. That's normal and useful during the day. You need higher blood pressure when you're active. But here's the problem. If you take vitamin D every morning, you're constantly reinforcing that daytime signal. Your body never fully shifts into nighttime rest and repair mode. Your sympathetic nervous system stays partially activated around the clock. The result? Your blood pressure doesn't dip properly during sleep. Normally, blood pressure should fall by 10 to 20% at night. This nocturnal dipping is absolutely essential for cardiovascular health. It gives your heart and arteries time to rest and recover. The research showed that people who took vitamin D in the morning had impaired nocturnal dipping. Their blood pressure stayed elevated during sleep. And poor nocturnal dipping is one of the strongest predictors of heart attack, stroke, and heart failure. People taking the same dose of vitamin D at night, just before bed, experience the opposite. Their nocturnal dipping improved, their blood pressure dropped appropriately during sleep, their hearts and arteries finally got the nightly rest they needed. Over 8 years, the nighttime vitamin D group had 30 to 40% fewer cardiovascular events, fewer heart attacks, fewer strokes, less heart failure, simply by changing when they took vitamin D. Morning dosing produced almost no blood pressure benefit, an average reduction of less than 2 points over 8 years. Nighttime dosing produced average reductions of 10 to 14 points. Same dose, same form, same people. The only difference was timing. This is why Harold's blood pressure didn't improve, even with perfect levels and the right form. Morning dosing was constantly stimulating his sympathetic nervous system and preventing nocturnal dipping, keeping his blood pressure elevated 24 hours a day. Once he switched to nighttime dosing, everything changed. Now you know all 5 mistakes. You understand why each one matters, how they compound each other, and why mistake number 1, taking vitamin D in the morning instead of at night, is so catastrophic. Let me give you the complete protocol, the gold standard. Follow this precisely, and vitamin D will deliver maximum blood pressure benefits. First, form vitamin D3, cholecalciferol, not D2. Check your bottle. It must be D3. Second, dose 4,000 to 6,000 IU daily, not 1,000 or 2,000. You need higher doses to reach optimal cardiovascular levels. Third, cofactors always pair your D3 with vitamin K2, 100 to 200 micrograms daily in the MK7 form. This prevents arterial calcification. Fourth, fat take vitamin D with 1 tablespoon of fish oil or cod liver oil. Omega-3 rich fats dramatically improve absorption and work synergistically with vitamin D. Fifth, timing. Take it at night before bed, not in the morning. Nighttime dosing delivers 400 to 500% better blood pressure reduction compared to morning dosing. Every single night, make this your bedtime routine. Brush your teeth. Take 5,000 IU of D3 with 200 micrograms of K2 and 1 tablespoon of fish oil. Then go to bed. This timing lets vitamin D work with your natural circadian rhythm instead of against it. Sixth, monitoring. After 3 months, ask your doctor to check your vitamin D level. Your goal is 50 to 70 nanograms per milliliter. If you're below 50, increase your dose. If you're above 70, reduce slightly. Find the dose that keeps you consistently in that optimal window. Seventh, blood pressure tracking. Check your blood pressure at home twice daily for the first few weeks, morning and evening. Keep a simple log. Most people start to see significant reductions within 8 to 12 weeks of correct supplementation. Eighth, medication adjustment. As your blood pressure drops, talk with your doctor about lowering your medications. Never stop or change doses on your own. Always work with your physician. But understand, when vitamin D is done right, many people are able to reduce or even eliminate one or more blood pressure drugs. Let me tell you about Susan, who followed this exact protocol. She's 72 years old with blood pressure averaging 156/94 on 3 medications. Her doctor wanted to add a fourth. Susan asked for 3 months to try this vitamin D protocol. She switched from morning D2 to nighttime D3. She added K2. She added fish oil. She increased her dose to 5,000 IU. 3 months later, her vitamin D level was 62. Her average blood pressure was 138/84. Her doctor reduced one medication. After 6 months, she averaged 132/78. A second medication was reduced. After 1 year on this protocol, Susan's blood pressure is well controlled on just one low-dose medication, down from the 4 her doctor originally planned. This works. The evidence is powerful, but you must do all of it correctly. Right form, right dose, right cofactors, right fat, right timing, right monitoring. Miss any one of these, and you'll lose much of the benefit. A few safety notes. Vitamin D at these doses is safe for almost everyone. But if you have kidney disease, sarcoidosis, or certain other medical conditions, talk with your doctor before using higher doses of vitamin D. If you're on blood thinners, ask your doctor before adding K2. Most people have no issues, but these are important potential interactions. The bottom line, your vitamin D routine might be doing almost nothing for your blood pressure or even harming your arteries if you're making one or more of these 5 mistakes. Taking it in the morning is the biggest mistake. It wipes out most of the cardiovascular benefit. Taking D2 instead of D3 offers minimal protection. Taking too low a dose prevents you from ever reaching optimal levels. Skipping K2 allows calcium to harden your arteries instead of your bones. Taking vitamin D without omega-3 fat drastically reduces absorption. Fix all 5 mistakes, and vitamin D becomes a powerful blood pressure tool, as effective as medication with no side effects, costing pennies a day, working for you every single night while you sleep. Harold's blood pressure dropped 34 points. Robert's dropped 26. Margaret's dropped 22. Susan avoided a 4th medication and went from 3 drugs to just 1, all by taking vitamin D correctly instead of the way they'd been doing it for years. If this gave you information you can use immediately, share it. Send it to anyone you know with high blood pressure. Think about how many people are taking vitamin D wrong right now, taking it in the morning, using D2, skipping K2, and getting none of the cardiovascular benefits. This information could literally change lives. Subscribe to this channel. My mission is to share evidence-based strategies that improve health without piling on more medications. And leave a comment. Were you making any of these 5 mistakes? Are you going to switch to nighttime dosing? Your experience might be exactly what someone else needs to hear. Thank you for watching. I'll see you in the next video, where we'll keep exploring practical, research-backed tools for taking control of your cardiovascular health.